2. Hi there, Unite for Community. Sue Weldon here, and we are here with the Ask the Experts. It is our February edition. I'm here with Dr. Sabitha Pillai-Friedman. She is actually one of our advisors, and she works with our women with sexual health, does a lot of counseling with our women. And we actually had a speaker series with you, Sabitha, and it was just, oh, the questions just kept coming fast and furious. It is such an important topic that we felt like we wanted to bring you back and have this Ask the Experts series. So what we do when we're live is, we try and give it a little time for people to start watching. We have about 3 people watching. We try and get some, some questions going. Know that, today we are live and you can actually ask your questions and I'll get through them in the chat. I have my staff watching on Facebook as well in case I miss any. And of course, if we do miss any, we do respond. We'll respond to this post and we'll post some of your questions and your answers. So that way we keep the conversation going. So Dr. Pillai-Friedman, thank you for coming with us today. How are you?
I am doing great. I really enjoyed doing the other show with you as well. So this is really a fun thing for me to do.
Yeah, it is. It is. Well, I think we're going to just get right to it. I'm going to share the screen a little bit, put you front and center. And let's just start it off. I know that, a lot of healthcare providers, I do remember when I was going through my cancer diagnosis, and it was just a conversation we just didn't have,
I know, yeah.
And why is that so many avoid talking about it?
Well, unfortunately, sexuality is not discussed very much in medical schools and in nursing school. And, most healthcare providers do not get training in sexuality. So those people who do get trained out of their own interests. They get additional courses, training. So a lot of people do not, prioritize it. And there's also a feeling that when you're dealing with cancer, it is such a, it had a reputation as a deadly disease that they don't want to talk about anything beyond survivorship. So sexuality was also not prioritized because let's just get this person healthy and get rid of the cancer. And then they kind of stop there. So I think that may have been the problem in healthcare providers not really talking about sexuality.
Yeah. Yeah. And really, it ends up your treatment. Sometimes our treatments stop and everybody's like, oh, good, they're done. Right. Like, oh, they're all done their therapy. They should be back to normal. And that just doesn't happen. It doesn't happen. It takes a long time. I know for me, it took me a good year, just to get myself back to normal and feel my womanhood again, and it took a lot of these integrative therapies that we have for our women and really diving in to learn more,
Absolutely. Now cancer, even metastatic cancer is considered a chronic illness. So the survivorship has increased so much. People live, well past the 5-year mark. So survivorship is really important. And part of survivorship is sexuality. Yep. So it's really important to talk about sexuality.
Absolutely. All right. Another question that comes up all the time are, what are some of the common changes that women experience to their body after cancer treatment? And how can these changes affect their sexual adjustment?
That's a very good question. So it depends on the kind of treatment people get. So some people have surgery, some people have chemo, some people have radiation, hormone therapy. So some people have all of it or one or more of it. So each of these treatments, have an impact on the physical adjustment. For instance, surgery could result in some pain, numbness in body parts. And, sometimes, the aftermath of surgery could be, some pain that is because of impingements that needs to be corrected through another surgery. And radiation could cause a lot of fatigue. And, it's very hard to think about sex when you're really tired.
Totally.
And, radiation burns is something that women talk to me about all the time, where the skin becomes too sensitive or not sensitive at all. And chemotherapy can result in vaginal dryness because chemotherapy can interfere with the production of estrogen. So vaginal dryness is a very common side effect of chemotherapy. And hair loss and weight gain, these things don't, make us feel good when we lose our hair, when our eyebrows, are also diminished a little bit. It's very hard to feel like ourselves. So those are the complaints I hear the most.
Yeah. I know that vaginal dryness, that was one of the questions. I mean, that's, that's what happens during chemotherapy. Those fast growing cells, are our vaginal lining, and they do get
Yes.
compromised. And I just remember, even when I was, going through that time in my life, like I didn't realize so many of these side effects would occur. It was sort of shocking to me. I'm like, come on, you're kidding me, like this too. Like, you just feel so depleted, and it's
Yes.
so good to, I am from the mindset that the more I know, the more I can prepare myself, and just, and get my mental, emotional state prepared as well.
Yes.
But
True.
that question just kept coming up, Sabitha, all the time. What can we use? And maybe we sort of move into that as well. There's so many products out there. I know that we get a donation that we put in our Her Care boxes from Good Clean Love that you recommend.
Yes.
So
Yes.
you want to share a little bit about that?
Yes. So our vaginal walls need moisturizing, just like our arms and legs do. So beyond the lubrication that is used during penetrative sex, intercourse, we need to moisturize our vaginal area and the vulva on a regular basis, like every day after shower. Just, when you think about moisturizing the rest of your body, moisturize your vaginal walls as well. So there are a lot of products out there that are labeled as moisturizers. So that even Good Clean Love has a moisturizer.
Yep.
And then so the key to finding products, so there are moisturizers and lubricants. The key to finding good products that are good for cancer survivors is to find products that do not have paraben and that do not have any like a menthol or anything that would arousing, cooling, warming. Those things are not necessary. All the arousal should come from your brain. It shouldn't come from something that you put in your vagina. It will just make it burn, because the vaginal walls and the vulva becomes very vulnerable and very kind of compromised during cancer treatment. So we should really not put something on it that can aggravate it even further. So I would recommend not using things with menthol, paraben, and make sure these are products that are recommended by oncologists, or speak to sex therapists and figure out. On our resource list we have places, stores, online stores where you can order these products, like sexualityresources.com is one resource that I usually add to my resource page, and it's run by a sex educator, and they have products for cancer survivors. So there's a product called Sliquid. There are different products that are available. Uber Lube is one.
Mm-hmm. Yeah. They actually, I'm glad you brought up the resource list, because if you go on Unite for Her's website, you go to uniteforher.org/her library, you'll see the speaker series, and you are actually up there, Sabitha, from our last speaker series, and right under there is your resource list. And it is powerful. It is so comprehensive. So know that you can go right there. We'll put it in our, in our Facebook post for people as well. But I think that's really valuable. One thing that I know our ladies also brought up was, they try and utilize things around the home, organic products like an organic coconut oil. And I know you have some thoughts on that. Yeah.
Well, coconut oil is not a good idea because, as I mentioned, after chemotherapy, your vaginal walls are very fragile. And when you use something like coconut oil, it can trap bacteria underneath it and, and cause infection. So I usually recommend oil-based products. But if you are having a really hard time, you could use a silicone product. So you could use the water-based moisturizer first and then use a silicone product to seal it. But when you're using a silicone moisturizer or lubricant, you should not be using a silicone sex toy. So you just have to be careful not to mix the two.
Okay.
But that's a silicone is because silicone also lasts longer, because water-based products can, if you're having intercourse with a water-based lubricant, it can stop working after some time, because it can, then it can add to friction, which can be painful. So you can use a combination of the two,
Okay.
silicone, water-based and silicone-based products.
Great. Okay. I know some of our women feel like, my body doesn't feel like mine, after all the and the poking, and how do I feel good about myself again, and my body?
It's a journey. I really, first of all, want to tell people that it's not something that you wake up tomorrow, you're going to feel great. This is a journey you're on. And so I tell people it's very important to kind of friend our bodies, because most of the times, our body doesn't feel like ours, because, our bodies have been altered. We've had surgery, hair fell off and grew back. So for all of these reasons, our body may not feel like it is our body. So it's really important for us to sort of, engage with it again with self-compassion. So this is a body that followed me through all these procedures and is still here for me. I'm going to love and cherish this body, and just welcoming it back is a really important step. And it cannot happen in a week, in a day, in a week. It takes time. But on an ongoing basis, give your body the love it deserves. And that would allow you to accept it, because acceptance comes from self-compassion.
Yeah, I love that. I know, because as we look in the mirror every day, we see those scars facing us every day, right?
Yes.
But now all of a sudden, the way that we approach that, I now look at those scars and just am so thankful for this body that got me through. I mean,
absolutely.
It's their battle, it's our battle, and they got through our battle scars. So
absolutely.
I remember you talking about that with our women a while ago, and it just sort of changed my way of thinking, and I appreciated it very much. Okay, another one. I feel very little desire. Will I ever feel desire again?
So, desire is something that's very nebulous. It ebbs and flows. And this is not just for cancer survivors. I treat women who are not affected by cancer, men not affected by cancer. I treat all genders. They all struggle with desire. I felt desire last year. I don't feel any desire now. And, so desire comes and goes. And desire comes from the brain. It's up here. So even though a body can be compromised in different ways, you can turn on and off your desire by the use of sexual fantasies, for instance. So, can you read books that arouse you? We all have specific things that turn us on. So go back and think about something that turned you on, and see if you can watch it again, and see if you can turn yourself again. So a lot of times, desire comes also from being able to pleasure ourselves first. So I highly recommend masturbation. And we also talked about vibrators before we started the show. And I think it's really important to sort of, ease into self-pleasuring. This is a really good way to get to know our own bodies, and to figure out what brings us desire, how do we get aroused, and are we able to have an orgasm by ourselves, and then share it with your partner. And fantasies are the biggest gifts to us, because by having fantasies, we can really create our own desire. And please be patient, because it takes time for us to kind of feel the desire and to go with it.
Yeah, it's great advice. I think it's it's a practice, right? I mean, we have all these practices that we give our women, different modalities, different yoga practices, meditation, Reiki, this is a practice, so you do have to be gentle with yourself, and it takes time. And I think that's great advice. Penetrative sex is painful, and we hear this a lot. That has a lot to do with that vaginal wall. What do I do? What do I do?
So first of all, moisturizing is a very important step, as I told you, to preserve the integrity of the vaginal walls. I would also highly recommend decentering intercourse. Why should that be the main meal? Can we think of it as, many different things? Can you, think about foreplay, other forms of sexual activity as the main event instead of thinking about intercourse as the main event? And so if couples can kind of talk about this, can we do other things today because I'm not up to it, and not force themselves to have intercourse when they're not feeling good and when they're experiencing pain? It's very, very important to not have intercourse and not to push yourself to continue if you're experiencing pain. It is not okay. Pain is not okay. Blood tearing or any, blood after intercourse is not okay. So stop it and engage in other forms of sexual pleasuring. There are so many other things you can do. Oral sex, manual, use vibrator, cuddling, kissing, hugging. All of these are sensual events. So instead of engaging in sexual intercourse, think about all the sensual things you can do with each other. And then make sure that your vaginal walls have healed from the chemotherapy and hormone therapy, and gradually start having penetrative sex. But before that, use dilators. There are graded dilators that you can use to sort of you yourself see whether you can have penetrative sex using a dilator. I think I put a reference for dilators in the resource list, but dilators are just, they look like little, they look like a lipstick. They, different sizes.
Yeah.
And you can just use it and see whether you're ready for it before you have penetrative sex with your partner.
Okay, I'll check our resource list and see if it's on there. If not, we'll get it in the post for sure. I think that you answered a couple of questions there that I had, and I think one of them is that conversation with your partner first, because I think a lot of us feel that we're afraid to touch in any other way because it's going to end up leading to intercourse. Yeah. And if you're having trouble with painful intercourse, then you don't want to have to say no, and it just leads to this whole negative feeling, and that's really valuable to sort of have this conversation first.
Yeah. Yes. So a lot of times touch becomes very fraught because, where is this going to go? Am I giving them ideas by touching them? Can I, then I'm not going to touch. So that creates a distance. There's no bonding. Touch is so important in relationships. Yeah. So it's very important to have a conversation and say, hey, my body is not up for intercourse. I'm not feeling good and I'm experiencing pain. So can we try something else for the time being? I love touching you. I love being close to you. I love cuddling with you. Can we do some of these things? Having a conversation really helps your partner know where you are, because they're also nervous and afraid, right? They're also, because you've been sick, they don't want to do anything to hurt you. And, they also don't want to say anything because they don't want to sound like they are eagerly awaiting to jump on you. So instead, that may liberate them to say, I was thinking the same thing. Let's cuddle, let's touch each other. I want to, really make you feel good. So you can have that sort of a conversation that can really liberate you from the anxiety and fear that comes with, like, am I going to be hurting? And it's, do I have to do this? You don't have to do anything.
Yeah, it's all
you
about.
You can do exactly what you want to do.
Yeah, it's so good. Here's one question was, I'm single and dating. When can I tell my date about my cancer status?
So a lot of different people have different ideas about it. And I work with a lot of single people. And this is my suggestion to them. You do not have to introduce cancer first. You really, you don't say to people, on your first date, I'm diabetic, or, I have IBS. You don't need to say that. So why talk about cancer status? I think it's very important to put yourself out there as a whole person. I'm a teacher, I'm an artist, I'm a mother, I love dogs, I like to travel. All of these wonderful things about you need to be up there first. So give cancer a small place in that entire beautiful portrait that you are, and assign cancer a small place. It's there, so you can talk about it on your second or third date after they get to know you first.
Yeah.
So this is how I look at it.
Yeah, we all want to feel that way. I know as survivors, we all feel like sometimes we have that like C on our forehead all the time.
Exactly.
Everybody knows. And when they say, how are you? You know exactly what they're talking about, like, so how are you? We all know the how are you. And as you get more and more years out, that does definitely change. But that's so nice to not even be able to feel like you have to talk about that right away. I love that advice. Yeah, so good. And then another part, should I I know the answer to this, but should I tell my partner when something doesn't feel good and does feel good, and, will it ruin the moment? And that was just one question we had.
Yes, it's a very, very good question. And this doesn't just apply to cancer survivors, by the way, or people going through cancer treatment. This applies to everybody. I once worked with a couple who had been in a long-term relationship for 25 years. And the entire time, one of the partners didn't like the way her partner rubbed her arm, and she didn't say anything to him. She kept quiet the whole time. And then after 25 years, they're in therapy with me. And I said, what do you, how do you talk to each other? And do you talk to each other about what feels good and what doesn't feel good? And she said, the way you kind of rub my arm when you get excited about sex, I don't like it. And she waited 25 years. So most of us don't tell our partners what doesn't, because we don't want to hurt their feelings. We also don't want to ruin the mood by saying, that part doesn't feel good anymore. So I am giving everybody permission to tell your partner what feels good and what doesn't feel good. Do not wait, do not wait 25 years. Do not wait 2 days.
Yeah.
Just tell them right away and tell them, or you could even say something like, I love it when you touch me this way. Can you touch me this way? It's really good. I'm not crazy about the way you touch me this way. So you give a compliment and then tell them what you don't like.
Yeah, it's good. Well, Dr. Pillai-Friedman, you gave us a lot of things to have permission for. And we appreciate that, because I think, we hold it in. We just hold it in, and we do have to give ourselves permission. It's such good advice. Do you have any other questions that you remember that would come up in some of our sessions? They're all the ones that we had chatted about. Of course, we will watch this chat and we will be there answering. I can always give you a call and send you an email for any questions that we need you to answer, and then put it in there. Anything else that you can think of? I feel like we touched on a good deal today.
I think we touched on a good deal. If there's one last thing that people can take with them, remember, sex doesn't have to be intercourse. There are so many wonderful aspects to sexuality and sensuality that you can enjoy no matter where you are in your cancer journey. And do not forget that touch is really, really important. So do not abandon touch. Even if you're kind of tired, you're lying in bed, get your partner to get into bed with you, cuddle, rub, give them a back rub, have them give you a back rub. Do not abandon touch. It's really important.
Yeah.
Thank you.
Oh, thank you. Well, thank you for joining us today. And Unite for Her, we're going to be doing this every month. So stay tuned. We're so grateful to have such incredible providers, experts, professionals in our space. And Sabitha, thank you. It was great to see you.
You're welcome. Thank you.
All righty. Have a good one. Have a good weekend, everyone.